Mindfulness Cognitive Therapy, MCT, for mental health recovery during COVID-19 pandemic. Venerable Rungruan Parpartsaro, Dr. Rungruan Lim Chupatipa. Background. The World Health Organization, WHO, has announced that since the start of the COVID-19 pandemic at the end of 2019, more than 3.4 million people have died of the disease, as of May 2021. Life can be scary, confusing, and upsetting while experiencing such life-stressing changes. The COVID-19 preventive measures themselves, such as isolation, lockdowns, restrictive regulations, mask wearing, and social distancing, indirectly cause some distressing disorders including loneliness, anxiety, stress, and sadness. The subject of troubled minds and mental errors is essential in directing human behavior. Buddhism identifies 5 hindrances to a healthy mind. The mental errors that arise from these 5 hindrances are called defilements. In fact, eliminating the rise of these defilements with insight wisdom is fundamental to Buddhist teaching and practice. During these times of stress and trauma at the hands of the COVID-19 pandemic, we can introduce ancient Buddhist wisdom to subdue the defilement of the 5 hindrances through mindfulness cognitive therapy, MCT. This is a means to resolve the present distressing trauma-related disorders outlined above. MCT has been found phenomenally successful among Buddhists for thousands of years and will undoubtedly be beneficial in resolving the current distressing disorders outlined above as well. Mindfulness cognitive therapy, MCT, procedure. In Buddhism, when the mind is experiencing any mental errors of 5 hindrances, the Buddha suggests performing the mindfulness meditation as sort of a basic practice of modern mindfulness cognitive therapy, MCT. The elimination of these hindrances can be achieved through 2 combined activities: firstly, having mindfulness to detect the arising hindrance, and secondly, having the knowledge to employ a specific opposite perception to offset the arising hindrance. Buddhism offers 4 techniques to handle troubling emotional objects of consciousness, as follows. 1. Having the mindfulness to avoid and to ignore the problem, something like seeing no evil, hearing no evil, and so on. 2. Having the mindfulness to contain and to manage to subdue the problem with the power of meditation. 3. Having the mindfulness to replace and to achieve balance with the problem with an opposite mental factor. 4. Having the mindfulness to contemplate the nature of emotional problems, and then bring in a proper knowledge to cope with the problems. Aaron Beck, a founder of Cognitive Behavioral Therapy, CBT, finds that emotion, thought, and behavior are closely related to each other. During the occurrences of negative emotions, if we have mindfulness observing what is happening, we can learn and correct our individual behavior. The role of mindfulness in CBT demonstrates that mindfulness brings about a cognitive process to change an individual behavior in the way one may respond to receiving a stimulus from the world. Later, in a discussion with the Holy Dalai Lama, they both concluded that in fact the Buddha was the first one to discover this cognitive behavioral therapy technique. A focus on this therapy is preliminary to the reduction of depression, stress disorders, anxiety, by developing an mindfulness cognitive therapy of the 14 steps as follows. 1. Identify a troubling situation or condition in life. 2. Understand the basics of how the mind processes and how problems arise within the mind. 3. Realize that these troubling problems can be contained and reduced from the mind. 4. Practice mindfulness in daily life by having mindfulness when walking up and down, having mindfulness in body movements, and having mindfulness in breathing. 5. Practice mindfulness meditation by applying mindfulness to become aware of your thoughts and emotions about these problems. 6. Perform mindfulness observation to identify negative or inaccurate thinking, and then analyzing the nature of the problem. 7. Having the insight to be aware of arising problems and learning the harmfulness or the disadvantage of the emotional problem of the mind, and then to balance the mind within the mind framework correctly. 8. Have the mindfulness to consider arising emotions. 9. Have the mindfulness to ignore an immoral object of consciousness. 10. Have the mindfulness to contain an arriving stimulus. 11. Have the mindfulness to abstain from emotions. 12. Have the mindfulness to realize how to deliberate the arising emotions of either depression or anxiety by having mindfulness now, thus ignoring whatever happened in the past and not being worried about what will happen in the future whatsoever. 13. Reshape negative or inaccurate thinking by learning how to maintain mindfulness to apply insight knowledge to cope with an arising problem properly. 14. Learning how to cope with problems in the world appropriately. Conclusion. During mindfulness meditation for the elimination of emotional illnesses, hindrances, we will learn about how to use mindfulness to balance and stabilize the mind to be in a neutral zone, that is, on an occasion when the mind goes too far into sensual desire, then handling mindfulness with peace will pull the mind back to be neutral. Meanwhile, when the mind goes too far into hatred, then having mindfulness with kindness to hold the mind to be neutral. On another occasion when the mind becomes excited, then having mindfulness staying at present moment to calm down an anxiety. Meanwhile, when the mind is in torpor and depressed, then always reinitiating mindfulness breathing will keep an awakened mind. The mind will have no doubt knowing how to handle all the situations properly, and by then the neutral mind will penetrate an absorption of the inner mind. Buddhist mindfulness meditation for the elimination of emotional problems, hindrances, is a perfect mental behavior therapy for curing various mental errors as popularly applied in the mindfulness cognitive therapy in modern times. The COVID-19 pandemic is a natural disease that may stay with us for quite some time, but it is our knowledge that guides us to live in the world. Buddhism is a perfect medicine to cure mankind's mental errors of defilements, and hopefully the mindfulness cognitive therapy will bring peace back to individuals and the world at this critical time.